आप सभी का हार्दिक स्वागत। हम इंडिपेंडेंट रिसर्च इथिक्स सोसाइटी की आयुष समृद्धि ज्ञान गंगा के 2045वें पड़ाव पर आपका हार्दिक स्वागत करते हैं। आज बुधवार होने के कारण आदरणीय अग्निहोत्री जी की प्रेरणा से प्रारंभ स्वस्थ व्रत की ये सीरीज, जिसमें हमारे आधार स्तंभ प्रोफेसर पी सुधाकर रेड्डी जी भी हैं, अर्पण जी भी हैं। स्वस्थ व्रत में आज आयुर्वेदिक प्रिवेंटिव एंड प्रोमोटिव मेजर्स का टॉपिक है, जिसे हम 2 दिन करना का प्लान किए हैं। आज भी है और 17 तारीख को रात को 9 बजे भी है। ये पूरा एनसीआईएसएम सिलेबस के क्रमानुसार है और एनसीआईएसएम का सिलेबस, जैसा कि हम जानते हैं, विस्तृत भी हुआ है और साइंटिफिक भी हुआ है। बहुत ही चेंज हुआ है, परिवर्तन हुआ है, जहां टीचरों को भी समझने की जरूरत है और छात्रों को तो समझाने की बहुत ज्यादा जरूरत है। मैं आप सभी का हार्दिक अभिनंदन करता हूं। अग्निहोत्री सर का, विष्णु प्रसाद शर्मा जी का, सुधाकर सर का, मेरे देवनाथ बेटे का, सभी का मैं, निशांत जी हमारे साथ हैं, आधार स्तंभ। तो मैं क्या कहूँ, ये आज आहा, प्रेम इंसा जी जुड़े हैं हमारे साथ इतने वर्षों बाद। भगवान जाने क्या नाराजगी है, लेकिन जुड़े हैं, बहुत अच्छा। तेजस्विनी जी भी जुड़ी हैं। मैं सभी को नमस्कार करते हुए आदरणीय विष्णु प्रसाद शर्मा जी से सादर प्रार्थना करता हूं उनके स्वागत उद्बोधन की।
Namaskar. Good evening to everybody. Hari Om. Respected Professor Nishan Suklaji, respected Professor V.K. Agnihotriji, respected Pawan Kumar Sharmaji, distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this AYUSH SAMRIDDHI International Webinar Series on Ayurvedic Preventive and Promotive Measures. Most important subject today we have. In this webinar, we have eminent speaker. I want to welcome Professor P. Sudhakar Reddy, Professor and Head Department of PG Studies in Shastra Vitta, JSS Ayurved Medical College, Doctor College from Mysuru. Namaskar, sir, and welcome you to this AYUSH Samriddhi International Webinar Series. Namaste,
sir. Thank you.
और कैसे है डॉक्टर?
ठीक हूँ सर, आप
Next,
कैसे हो
I
सर?
want to welcome. बस बढ़िया हूँ, फर्स्ट क्लास, बढ़िया.
सर.
Next, I want to welcome Dr. Parikshit Devnath, Associate Professor in HOD, Department of Shastravitta, Ayurvedic Medical College and Wuhan, University of Science and Technology, Meghalaya. वेलकम परीक्षित देवनाथ. परीक्षित देवनाथ, आप यहाँ ज्वाइन कर लिया है, हमको फोन ही नहीं किया है आप. ठीक है, मोस्ट वेलकम. ये तो हम लोग का गुवाहाटी पहुंचना है यहाँ एक. So once again, I welcome all the eminent speaker, distinguished guests, ladies and gentlemen, to this AYUSH Samriddhi International Webinar Series on Ayurvedic Prevention and Promotive Measures. Once again, I welcome all the eminent speaker, distinguished guests, ladies and gentlemen. सबको स्वागत करते हूँ. नमस्कार. ओवर टू पवन जी.
बहुत बहुत आभार सर. मैं आदरणीय अग्निहोत्री सर से प्रार्थना करता हूं.
धन्यवाद प्रोफेसर पवन शर्मा जी. सभी को बहुत बहुत प्रणाम, सभी को नमस्कार. वी वेलकम all the guest speakers and also all the dignitaries now joined our platform. Our guest speakers are today, as Professor Vishnu Prasad Sharma ji told, our Professor P. Sudhakar Reddy ji. He is head of the department JSS Mysuru, and our one of Namaskar, and our next one is Dr. Parikshit Devnath ji. So I welcome both of you along with our all the guest speakers. When we talk about the subjective topic of today's webinar, of course, guided by NCISM, we are going to talk on the preventive and promotive measures of Ayurveda. We know that for each science, principles are very important. And if the principles are not there, it's very difficult to say that information is scientific. So having principles of Ayurveda with a special reference to the its prevention aspect is concerned with in reference to diseases, and also the principles of promotion of the status of health in the terms of increasement in immunity, increasement of healthy diet and appetite, good hours of sleep, and making a perfection to perform day-to-day life in a very palatable manner. So these all depends upon the principles, and we are having lot of informations, that too in a form of instructions or guidance in all our text, including our Dincharya, Richcharya, Sandhyacharya, Raticharya, Veg Vidharan, the observance of Tre Upastam. So these all are having the pencils. So without any doubt, we are here to establish and say confidently that Ayurvedic information and text is completely scientific and for the greater welfare of the human being. With these initial words, I again thank all the guest speakers, and being a webinar of Swasthvrat, with all due regards and respect, I would like to invite Professor P. Sudhakar Reddy ji for his guidance, his all good speech and informations pertaining to our today's subject, and also he will bless our today's webinar. Namaskar, sir.
Namaskar, sir. Namaskar. Good evening to all.
Good evening.
Respected Shukla, sir. Respected Sharma, sir. Vishnu Prasad Sharma, sir. V.K. Agnihotra, sir. And my other colleague. And Dr. My students also joined here, 2 or 3. And as Pawan Sharma, sir told, this is designed for based on the NCSM syllabus. Unfortunately, I was the chairman and also chairman for development of the Swasthvrat syllabus, where we kept the
That's why I
preventive and
told that
promotive
you
measures.
have to bless the topic and occasion. Yes.
Yes,
Great,
sir.
great.
And what I am going to deal, these points will be useful for especially for the students, how to write examination if they listen through YouTube. And just because of the based on the syllabus point. Okay. Now I would like to share my screen. So is it visible, sir?
Yes. Full size कर दीजिए. Yes.
Yes, sir.
Yeah. Wow.
Visible, sir?
Wonderful. Yeah.
Okay,
Yeah.
sir.
Good. Great.
Thank you very much once again giving this opportunity, Sharma sir and Agnihotra sir. And before going to preventive medicines, why we need Arogya? So the students can write first what is the introduction as introduction, and other people also when you are speaking regarding health and etc. We need to speak about what is importance of Arogya in Ayurveda. Charaka says, Dharmartha Kama Mokshanam Arogyam Moolam Uttamam. So, Arogya is a root cause to achieve Dharma, Artha, Kama, and Moksha. And also in Subhashita, they say, Sharira Madhyam Kal Dharma Sadhanam. So, without Sharira, nothing is there. So, Sharira is a media to achieve something. And Charaka again says the importance of Sharira. Sarvamanyat Parityajya Shariram Anupalayet. Tat Abhavehi Bhavanam Sarva Bhava Shariram. So Sharira is the Moola Karana for everything. Without Sharira, nothing is there in the world to achieve. So that Sharira must be in Arogya. Because through Sharira only, we are going to achieve Dharma, Artha, Kama, Moksham. So that's why the importance of Arogya lies in this loka. And now let us see what are the preventive principles measures to maintain that Arogya. Okay. So basis for prevention. So actually, what is the basis for prevention in Ayurveda? Sharangadara Samhita says, न जन्तुः कश्चित् अमरः पृथिव्यां जायते क्वचित् अतो मृत्युरनिवार्यः स्यात् किन्तु रोगान् निवारयेत्. So beautifully explained. Because in a universe, the jantuh kashchid amaraha. So the living beings, the mrityu is definite and we can't prevent it. But which is can be prevented? The disease can be prevented. For every living being, they may get disease. The disease can be prevented, but death cannot be prevented. So that's why the prevention lies a very important phenomena. And prevention means what? The action of stopping something from happening or arising. So here, disease prevention means activities designed to protect patients, other members of the public from actual or potential health threats and their harmful consequences. But when you see the prevention, it's only prevention of the diseases, promotion of the health, and etc. So preventive medicine also defined as preventive medicine is the art and science of prevention, promotion of the health, prevention of the diseases, disability limitation, and rehabilitation. So four aspects are there. But when you speak about the prevention, there are three levels of prevention, but newly added is fourth one. That is called primordial. So we can say the levels of prevention according to modern medicine. We have primordial prevention, primary prevention, secondary prevention, and tertiary prevention. So for example, primordial prevention, where the person is not exposed to the uh, risk factors, then only we are going to take. That's called primordial prevention. Example, let me say, when the child taken birth or in the childhood, so up to 10 years, etc., he is healthy. He is not at all having any risk factors to get the disease. Obesity is there. Obesity may occur after a few years, but the childhood onwards, if we are asking them to not to go for excessive sweets or chocolates or having the physical, making them to go for regular physical exercise, etc. So this can be useful as a prevention in future. That's called primordial prevention, where risk factors are not there, but still we are taking the preventive measures. And primary prevention, as we know, the risk factors are surrounding us, but that we should not enter into the body. That we are taking primary prevention. Secondary, once disease occur, again we have to prevent the consequences. We have to prevent the further progression of disease. That's called secondary prevention. And tertiary prevention, as we know, when the treatment is not possible and also not treated or we got some disability, there what we are going to disability limitation and rehabilitation. So that is modern medicine. But in Ayurveda, according to Ayurveda, observing the principles of Dinacharya, Ruticharya, Sadvrita, Tripastambapalana, and Rasayana from childhood. That is important. From childhood are the actions in primordial prevention. So all preventive measures, whatever there in Ayurveda, all comes under primordial prevention, where from the childhood onwards, one observes these things, so we can prevent the diseases. And primary prevention, it is defined as action taken prior to the onset of disease, which removes the possibilities that the disease will ever occur. It signifies intervention in pre-pathogenous phase of the disease or health problem. So here in Charaka Samhita says, Viparita gunastesham swastavrutter vidvitaha sama sarvarasam satmam samadhato prasashyate. That means diet and exercise regimen which opposite neutralize dosha's properties are prescribed for maintaining the health. Habitual intake of balanced diet with all rasas in proportionate quantity is recommended for equilibrium state of the doshas. That is also we can say primary prevention. Also we can say tyagaha pragnaparadhanam indriyopashamaha smritihi deshakala atmavijnanam सद्वृत्तस्य अनुवर्तनम् आगन्तूनाम् अनुत्पत्ताश मार्गो निदर्शितः प्राज्ञः प्रागेव तत् कुर्यादिदं विद्यादात्मनः. That is avoidance of such emotions, control over sense organs, motor organs, memorizing the specific knowledge of place, time, one's own self. That means where you are. So know about your place, know about your time, that season, know about yourself, and take necessary food and etc. That is called. And following regimen of good conduct are some of the ways to prevent exogenous diseases. Therefore, An intelligent person, desirous of his own well-being, shall follow these suitable measures well in advance. That's called primary prevention. Tyagaha prajnaparadhanam indriyopasamasmritihi deshakala atmavijnanam etc. Again, Charaka says, Jayante anaturas tasmat swastha vrtta paro bhavet. If you don't want to get the diseases, if you don't want to get diseases, and if you want to maintain the health, you must follow the swastha vrtta. Therefore, the course of life conducive to the maintenance of good health should be followed. Then, Tacha Nityam Prayanjita Swastham Enan Vartate Ajatanam Vikaranam Anutpattikaram Chayat. One should follow those in the daily regimen which maintains health as well as prevent onset of the diseases. And Rutshodhana. Again, Rutshodhana is also a primary prevention where diseases are not occurred, but we are prone to get the disease as per the Rutu dosha variation. That's why Shitotphavam Doshachayam Vasante Vishodhayan. Grishman Abrakale Ganatyaye Varshikamashu Samyak Prapnoti Rogan Jatan Na Jatu. So according to Rutus, there will be vitiation of the doshas, they may cause the diseases. That diseases can be prevented if you are going for the Rutushodhana. Always, I say one example for the students especially. Rutushodhana is nothing but periodical purification. Like our vehicle servicing, we are we are giving vehicle service periodically, so that the vehicle may have good condition. That way, every season, if you are undergoing purification, the diseases cannot occur. We can also promote the health. So the best preventive measure in Ayurveda is Ritu Shodhana. According to Ritu, if you are undergoing the Shodhana, the diseases may not occur. And once again, one more is there. Present day, all the diseases are occurring because of the junk food, etc. That becomes Dushi Visha. So the Dushi Visha can be prevented by undergoing periodical Rutushodhana. And Vagbata says once again, Nityam Hitahara Vihara Sevi Samikshakari Vishesa Sattaha Data Samaha Satyaparaha Ksamavan Aptopasevi Bhavatyarogaha. The person who follows these rules and regulation can be maintain diseases and maintain the health and prevent the diseases. So he will be away from the disease Bhavatyarogaha. So that's why these all comes under primary prevention, where diseases are not occurred, but we may prone to get. So if you take all these measures, we can prevent the diseases as a primary prevention. Secondary prevention, if you are not followed all these things by chance, but we got disease, what we can say, it is defined as undertaking measures in the early stages of the disease or even much before the development of permanent pathology in the individual. The intervention in this level is early diagnosis and early treatment. Early diagnosis can be achieved by screening test and case finding program. That is modern science. But in Ayurveda, whether they mentioned anything secondary prevention, when a disease occurs, what we can do. So in Ayurveda, secondary prevention is mentioned. As Charakacharya says, Tasmat Prageva Rogebhyo Rogeshu Taraneshu Va Veshajahi Pratikurvita Ya Ichet Sukumatmanaha. A person who is desirous of his well-being should try to get rid of diseases in early stage. So before complete manifestation by getting treated with appropriate therapies. So exactly this is, we can say that early diagnosis and early treatment principle also there in Ayurveda as a secondary prevention. And if we come to tertiary prevention, this is the measure undertaken when the disease process is sufficiently advanced in the late pathogenic phase. The tertiary prevention can be adopted by two methods of intervention according to modern medicine. That's called disability limitation and rehabilitation. Okay, so this will be there. And in Ayurveda, what we can say, Sadvrta, Acharasayana, Naimitic Rasayana in chronic disorders. What we can Naimitic Rasayana, we can say. So all comes under tertiary prevention. And importance of Ahara in health promotion. So Acharyas, they spoke more about Ahara, which is most important part. And here Ahara is one among the Trayapastamba, we know very well. And Pranaha Pranabhutam Annamanno Lokabhidavati. Our prana is depends upon only Ahara. Ahara Prana Sadhyo Balakrit, which gives immediate bala to the body. And Pranina Pudarmulam Aharam. Again, also says, Kashyapa says again, Arogyam Bhojanadinam. Your Arogya depends upon what food you are taking. Ahara Rasapradhanam. So we know Aushadha is Virya Pradhana, Ahara is Rasa Pradhana. That's why Sarva Rasabhyaso Balavakarnam Srishtam, Charaka says. So every day in your food, all the rasas in proportionately if you are taking, your bala will be increasing. The bala is again depends upon the arogya. And again, we can have Shishtikan Chal Mudgamcha Saindhavamalaka Yavan Antariksham Paya Sarpi Jangal Masavi. Whatever Charaka says, the Nitya Sevani Ahara Dravyas, if you are included in your food, definitely you are going to promote your health. Because this concept of Shishtikan Chal Mudgamcha Saindhavamalaka Yavan consists of all the nutrients which we require, like Shishtikan, the Shali, you can say cereals, that carbohydrate diet. Mudga, you can say pulses, proteins, Saindhava Amalakam, Saindhava, minerals, Amalaka, vitamin C will be there. Yava, again cereals, Antarikjam, the Jaraha. That means that water, he says that water is important. Water is a big component of our body. So Payaha, milk, Sarpi, again we know very well. Payaha Sarpi, that again, this Ajasakra Saina, also there, Jangalam, Madhuthambe says, Madhya. So these are all, if you are including, it gives a balanced diet for a person and it promotes the health. And again, Charaka says the importance of ahara. Shit trimshit sahasrani ratrinam hitabhojanaha. Jivat anaturo jantu jitatma tasmat satam. That means if you are following the proper ahara or itahahara, hitabhojana, the person lives 36,000 nights. That means nothing but 365 days. So 365 days, you want to be healthy, you want to be, this is free status, you want to go for hita bhojana. Ahara sambhavam vastu rogashcha ahara sambhavaha. Hita hita vishesachasha sukha dukkha yoho. Again he says that your disease condition, your health condition depends upon the ahara. That ahara is important in promotion of the health. And again Bhagavad Gita says, ahara shuddhav sattva shuddhav dhruva smritihi. We know very well. And the importance of prevention of disease through vihara. Till now we have spoken regarding the ahara in promotion of the health and prevention of diseases. Now, if you see the vihara, primary prevention, what is that? Action taken prior before the manifestation disease. Avoid vega dharana and udhirana. So we know that vego dharana and dharana, forceful udhirana, and again vega dharana cause for the diseases. So you just avoid vega dharana and udhirana, that health will be promoted. And do Ritu Anusara Shodhana, adopt principles of Patya in Ahara and Vihara, adopt Dinacharya, Ratacharya in management of Apatarpanajanya Vyadi, especially Apatarpanajanya Vyadi. Mantha, prepared water by adding sugar or sweet things like Dadima without oxygen substances deficiency immediately. That means for Apatarpanajanya Vyadi also, there are some measures mentioned in Ayurveda. And as a secondary prevention, to reduce and limit the impairment and help the system to come back to the normalcy. Therapeutic nutrition, that is ahara based on ahara vidhi vidhana, etc. Ahara vidhi visheshayatana, etc. Rasayana sevana, rehabilitation at psychological level, like sattva chikitsa, vocational and medicinal component, that's called aushadha sevana. That's come down secondary prevention. Okay. And the measures we know very well, dinacharya, if we follow Brahmi Murta Uttishtet onwards up to the Nidra, definitely we can maintain health. These are the preventive measures in Ayurveda, especially Brahmi Murta Uttishtet, Grita Darpa Darshana. After getting up from the bed, we can see your face through Grita or Darpana. Grita is not possible because it is costly and also we can't see our face clearly. But Darpa, that is mirror, see your face through mirror after getting up, because every day if you are seeing your face, so there what are the changes are there, what because we can take it, we can also promote your health. But indirectly one more, the internal conflicts also can be removed. If you, for example, you are seeing somebody's face after getting up from the bed, you went to your work or college, etc. Something went wrong. What you will think? So today morning, after getting up from the bed, I have seen this person's face. That's why all came to me. So that mind, the internal conflict will come. But if you see your face only, if at all something is going wrong, what you will say? You will never scold yourself. But that time you realize that what went wrong, why the bad things happened to me. So that way the internal conflicts will be prevented by just seeing your face through darpana. And Usha Jalapana, as we know very well, Mala Visarjana, as per that time, Dantadhavana, Jiva Nirlekana, Gandusha Kavaladharana, Anjana, Pratamasanasya, Dhumapana, Abhyanga. So whatever I quoted from the Acharyas only, but can be adopted practically. Dantadhavana we know very well. So what is it? Among the children, among the people, you promote Ayurvedic toothpaste, Ayurvedic Dantadhavana Churna, which are available in the market. Minimum, they should start their Ayurveda way from the starting of the Dantadhavana, Jiva Nirlekana, Gandusha and Kavala. It's not a big procedure. We can educate the people just to go for only Sukoshna Jala with Sukoshna Jala, Gandusha or Kavala, or else Triphala with Madhu. That simple things we can promote. It promotes the oral health. Dantadhavana, Jiva Nirlekana, Gandusha Kavala, they follow, that will be promoting your oral health. And Anjana, eyes purpose, if not possible also, just we go for Ayurvedic method preparations, like any Colombo available, and Pratamasanasya is available, any Taila, especially Anataila, 2 drops instilling daily, morning and evening, that promotes our health. Dhumapana and Abhyanga. And Vyayama, Snana, Vastradharana, Gandhamalyan Lepana, Bhojana Vidhi, Tambula Sevana, Vritti Dharma. You go for do your duty according to your dharma. That is Vritti Dharma, Achamana and Mantracharana. So these things are again important to promote the health. And Sandhya Vidhi. Sandhya Vidhi, Sandhya, morning and evening, offering, praying the God. Sandhya Vidhi, Ratri Bhojanam and Nidra. And the Ratri Bhojanam, again, three uh, things are there mentioned by Vaprakasha. Ratro Pratham Praharantara. That is before 8 o'clock only. First Prahara of the night, take food. And Nidra, also described that where to sleep, how to sleep, and other thing, how much also there. And also Maithuna. So these 3 things are there in Ratri Bhojana. We have to promote to the among the people. Nidra. And once in a 5 days, that is Dinacharya up to Nidra. Once in a 5 days also they mentioned Naka Smasra Roma Kartanam. This also they mentioned. And Swastha Rakshatam, apart from this Dinacharya, Raticharya, Ruticharya, we have simple procedure like Bhojanante Pibet Takram, Vasarante Pibet Payaha, Nishante cha Pibet Vari, Trivirogo na Jayate. Trivirogans, Vata Pitta Kapha, are the 3 types of rogas can be prevented simple by taking Bhojanante Pibet Takram. After taking food, you can go for the buttermilks. And Vasarante, that is Pibet Payaha, night while going to sleep, you take in milk. So during COVID-19, people are advised to take milk with Haridra, the golden milk. So Ayurveda, they mentioned that Pibet Payaha Vasarante in night. And Nishante cha Pibet Vari. After getting from the bed, you can take water. So these 3 principles are very important principles and measures to promote the health, to prevent the diseases. And principles to maintain health, lastly, I can say Dinacharya, Rajacharya, Sadhuta Palana, Trayapastam Palana, Rasayana Sevana. And how to follow above principles again he says. So how to follow this principle? Nagari, Nagaraseva, Rataseva Ratiyatha, Sharirasya Medhavi, Kriteshwa Vahito Bhavet. So like a Nagarapalaka, you should like a Rathasarathi, and we should be very meticulously vigilant and utmost care we should give to follow these rules like a Nagarapalaka and also Rathasarathi. That's what Charaka says. Okay. If you follow these things, so you can prevent the diseases, you can promote the health. And lastly, we can say Sadvrittam or Swastavrittam Ethodishtam Yah Samyak Anathishtati Sa Samaha Shidam Avyadhirayashana Vijjate. So everybody wanted a happy and healthy life. So without any diseases, we have to live whatever 100 years. So they says 100 years. Now the lifespan is not 100 years. We don't know. If we follow the rules and regulations of Ayurveda like Dinacharya, Rucharya, etc., we may live 100 years also. But whatever years you are going to live, it should be, or we should be, live without any diseases. That is important. That's why Acharya says Sadvrittam Ethodishtam, as per the text, as per the prescription. If you follow Swastavritta or Sadvritta, you can live 100 years without any diseases. Okay, that's all. And again, you will be praised by good people, earns fame all over the world. and also attains virtue and wealth, becomes a friend of all creatures if you follow Swastha and Sadvrita. So these are all things the students can write in the examination if they ask question, and also generally other people also can promote this among the general public regarding the preventive measures and promotive measures in Ayurveda. This is my presentation, sir. Thank you very much for giving this opportunity. Hope I have done justice to my topic.
Thank you, sir. Thank you, Dr. Professor Reddy. As expected, you narrated all the subject very clearly, because you are the masterpiece and backbone of putting these topics under the Sanskrit subject syllabus under the guidance of NCISM. So in that way, it becomes very vital. And what I feel that the richest part of our Sanskrit is a combination of Dincharya, Chitya, Sandhacharya, Sadvit Palan, Veg Vidharan, Nitya Sevani, Rasayan, etc., that all you incorporated in your address. And also putting the emphasis over the primordial, primary, secondary, and tertiary concepts of the overall development of preventive medicine in these subheadings. So this made it very easy to the students and also the teachers that the text is the same, and we have to categorize this topic in these words or in these subheadings, and it will become the easy because you quoted all those say shlokas which are already there, right from Dharmarth Kamakshanam to Sarvam Annat Parityajya to Narohitar Vidar Seri. The things are there. We have to just categorize them and to focus to be given to these principles. Thank you so much for your kind cooperation, your availability, and also your guidance. And we do hope that you will be here with us for our next webinar, furthering on the
Yes, sir. Yes,
Pongal.
sir. Available, sir. Available. Thank you,
Thank
sir.
you.
Thank you.
Thank you so much.
Thank you very much, sir.
Okay. Now we will like to invite our next guest speakers of today, and he is none other than Dr. our Parikshit Devnath. After a big gap, we got it, and as per the information laid by Professor Vishnu Sharma ji, I was expecting that we are very much there in the AYUSH University in Gorakhpur, VP. But as per his address, you are now there in Meghalaya. It's also very good that you are in Northeast area. So you please kindly start your presentation on the same topic which Professor Reddy sir covered. Welcome.
Yes, sir. Sir, I'm audible?
Yeah, you are audible.
Yeah. Thank you, sir, for your invitation. And I also once again thank you and Pawan Sharma sir and Dr. Vishnu Sharma sir. So today's topic, what I'd like to discuss is what we say, as per this today's concept. So preventive and promotive measures. So I will start with one thing. The question is why Ayurveda? So to get the answers for preventive and promotive measures, why we need Ayurveda, we already know it's an ancient knowledge with for the life of preventive aspect or what we say maintenance of life. But here I like to focus that many areas we think it's all about illness. Then we have talked also as for wellness. I would like to say after wellness, there is a determinant, what we can say, it's called happiness. We already know that there is some World Happiness Index measurements, and India is very far behind. And the topmost countries like Denmark, Sweden, these are the countries which are highest in the happiness index. So our aim will be not only just wellness, we should strive for happiness. As we know that Ayurveda is deeply rooted into our traditions and cultures. So when we are talking about improving the health, wellness, or happiness of the community, we have to work on the public health aspect from the ground level as it is deeply rooted. So, thinking about the traditions and cultures and its integration in the system, we should strive. And as an ardent follower of Ayurveda, we know we have very much potential to meet the health and wellness needs for all. But till now, globally as well in India, in the public health sector, it's not yet totally incorporated. So this is everybody we know and everything that we should use Ayurveda as a prevention, promotive and maintenance, not merely for management of the disease. But another aspect is personalized holistic approach, which doesn't exist in the so-called conventional Western system of medicine, or whether it's coming up. But we had this concept since ages. So when we start preventive and promotive measures, so we have to measure, then there is a measurement criteria. We should know how to measure and what to measure. If you want to say, I am well, I am happy, I am free of diseases, so we need to measure. It should be quantified. So, as we know, the determinants of health depend upon many aspects: health services, environment, education, employment conditions, social environment, everything. Also, to implement this preventive and promotive measures, we need to develop some roadmaps. And these roadmaps should be incorporated comprehensively to improve the community health. We also discuss personalized holistic approach, but to improve the health of the society as a whole, as a whole, uh, community health approach must be adopted. And we very well know that since Ayurveda is deeply rooted in our culture and tradition, it can very easily be approached and tackled. So, what I was talking about health indicators, there are many health indicators which can be counted upon to measure the preventive and promotive measures. So, like this, one is more. So maximum very much common indicators are morbidity and mortality indicators. Other more disability indicators. There are other many indicators, health delivery indicators, quality of life indicators. These are very much important subjects we must address. And health delivery indicators, at present, we all know Ministry of AYUSH was established to look after the health system of health system. But more approachable measures should be required to implement the community health related approach of Swasthawitra in the present public health domain. So this is a very important indicator. Also the health utilization indicator. This indicator is also very much important, that we don't know how much the health is being Ayurvedic approaches are utilized, or what government of India is thinking has been incorporated. And also we know that present social and mental health indicators are one of the such things which will be based on the happiness index. If we want to say we need measure the happiness index, these are the indicators. And this, along with that, socio-economic indicators are very much tightly linked to it. So, what do we say? We should look beyond disability and disease. Indicators, what you are talking, discussed, we should always look beyond disability and disease, because there are many more things to achieve. And among them, there are many points which was taken from serious in science, like physical and mental illness, aging, injury and disability, mobility, social interaction, and work. These are the functioning captures of health affects daily life and consequent to well-being. Now, what we need as per Ayurveda, if physical health improvement is needed, which means regular physical activity, good nutrition, and adequate rest. These we know. Mental emotional health, we need balanced state of mind, techniques to reduce stress levels and emotional well-being. And in present situation, we are being plagued by different types and also forms of stress-inducing subjects. Next is the other important factor for healthy well-being. We need to have a proper living condition, working environment, and also climate. As we know, the diverse climate change is happening, which is changing our physical, environmental, social environment, and lifestyle. And along with that, our body response is being changed. Additional considerations to being healthy or happy, as previously our eminent speaker has already discussed, Dinsharya, Ritucharya, Satvita, but only these things cannot make the prevention or promotive measures good. Two factors, another one is socioeconomic factor is also a very important factor to be happy, to be healthy, to be free of disease. And unchangeable factor is the genetic factor, which we cannot change, but we can modify. And what already discussed, that social determinants of health is also very important, like economic stability, healthcare, neighborhood and environment, education, social and community context. Like Thomas Edison has told, the doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet and in the cause and prevention of disease. This we already know. This has been told and discussed in Ayurveda, but we don't follow. So when somebody from Western civilization or Western culture is telling this to follow, I think it should be in our mind to not only base our thinking on giving medicine, rather than that, we should focus on being happy, and this happiness will come from making ourselves in each and every possible way to be having quality of life improved. So, what we could implement in our practice, implementing Ayurveda in our practice. So, pillars of prevention will have these points, which I am going to discuss. These are the factors of health, and these factors, if we can modify or change, we can prevent diseases and promote health. First is health prevention. It's balancing the basic physical, mental, and spiritual well-being, lifestyle. Next is self-knowledge. Very often we get sick and we discover our own knowledge of wisdom. So knowing better ourselves, to know yourself, is the opportunity which we should have, and know ourselves to get rid of unwanted situations. Next is in tune with nature. The mastery of being healthy is to be planted with nature. And this thing will prevent and plays an important role in the prevention
तुम्हारी
of.
आवाज बेटा कट कट के आ रही है, तुम्हारी आवाज सही नहीं आ रही है। शुरुआत से कट कट के आ रही है, बीच बीच में कट रही है। अग्निहोत्री सर थोड़ा देखिए ना।
हमने कहा कि पता नहीं उसकी प्रॉब्लम होगी सिग्नल की, आवाज थोड़ा माइक से दूर रखिए, माउथ को
या तो यदि सिग्नल की प्रॉब्लम है तो वीडियो बंद करिए।
हाँ, माइक को थोड़ा दूर रख के और वीडियो ऑफ करके बेटर
है।
प्रेजेंटेशन हो जाएगा जी।
अब सुनाई देगा अच्छी तरह से सर?
नहीं, आवाज में कुछ हल्की सी इको है, लेकिन वो कट के आ रही है। माइक से और माउथ का आप स्पेस थोड़ा बढ़ा लिए है अगर। हाँ
मैं
हाँ, या इसको हटा दिए, यस, तो क्लियर हो जाएगी। ईयरफोन हटाइए।
सर वन थिंग जस्ट
हाँ, उसे हटा लिए।
सही तरह से।
नहीं, तो वैसे ही है।
हेलो।
हाँ हाँ, आ रही है, आवाज आ रही है, लेकिन वो अभी अभी अब क्लियर नहीं हुई अभी आवाज।
ओके सर, जस्ट गिव मी 1 मिनट, मैं तो फिर मोबाइल से ज्वाइन होके करता हूँ सर।
मोबाइल बहुत अच्छा है, ठीक है।
सर अभी सुनाई देगा
बहुत
प्रॉपरली?
बढ़िया, फर्स्ट क्लास हो गई, यस, ठीक है।
ओके सर।
कंटिन्यू, कंटिन्यू करिए।
हाँ सर, तो इन ट्यून विथ नेचर में हम बोल रहे थे कि इट वाज टेलिंग दैट यू शुड बी एट पार विथ नेचर। नेक्स्ट, like increases like first important principle in considering preventive measures is a body type is increased by experiences and influences like food, weather, and season with qualities similar to it. An antidote to like increases like is opposite qualities decrease or balance. This is the key to healing. तो normally हम लोग ये बोल सकते हैं सेम चीज सेम को अट्रैक्ट करती है और एंटीडोट्स देना ही जरूरी पड़ेगा ये कुछ भी हील करने के लिए। Next is food and diet. So, eating healthy and eating right. In Ayurveda, अगर पित्त पर्सन ज्यादा स्पाइसी फूड सावरी फूड खाएगा तो पित्त बढ़ेगा। वाटर पर्सन ईटिंग हाई रॉ डाइट, रॉ फूड डाइट, एंड कफर पर्सन ईटिंग फ्राइड डेयरी कोल्ड फूड। सो हमको ऑलवेज वी शुड सीक दैट we are eating the right food with right balance which keeps our doshas balanced. Also, preventive measures will be food combinations, stale foods, chemical additives, wrong eating habits leads to disease, as we know. So preventive measures will be incompatible food should not be taken. Don't cook with honey. Eat fruits. Don't eat leftovers. Eat warm and fresh meals. No fruit after meal. Eat in a calm and comfortable place. When having your mind in a stable position, when not upset or in anger like that. Sit quiet for a few minutes after meal. Eat slowly at regular times while sitting down. Eat only when you are hungry. Stop before full. And be present means when you are taking food, you should concentrate only on the food, not anything else. Then it comes on the seasons. Ayurveda classifies seasons according to diseases. So in particular seasons, some of the among the three doshas, particular dosha will be get imbalanced. So each season brings its own challenges. So we need to take precautions and certain measures during the seasons, and by this we can balance the doshas. Next come exercise. This is a very important factor. which can influence health and prevention of disease. And sweating helps eliminate toxins, reduce fat, and makes, as a general feel good factor is there. Importantly, it is seen that at present, all the scientific documents also state that moderate exercise per day will keep the cardiovascular system healthy, keeps metabolic disorders at bay. Next will be age. So as we know, in certain age, certain diseases are common, certain diseases will be predominant, and certain diseases will be coming. So we should beforehand be ready and mentally acceptable that this is going to happen. We cannot change the outcomings of the disease, but what we can do is we can prepare ourselves beforehand and try to be healthy at that juncture of life. Like at present, we are focusing on geriatric healthcare, which is a very important aspect of healthy aging. And at present, the very important factor is mental and emotional health. As we already know, more than physical health at the present times, we are being plagued by different mental and emotional stages in life, and this is very much affecting our well-being and health. So mentally, we need to stay healthy, and for that, I think a very important factor that Ayurveda can help is through yoga and other meditation techniques. So, as we know, emotions have an affinity with certain organs, like lungs will be affected if we are in grief and sadness. In anger, liver is affected. In hatred, gallbladder is affected. Kidneys, in fear, kidneys are affected. In nervousness, colon are affected. So knowing how to deal with emotion is a key factor in disease prevention. And through yoga, there are very numerous mudras and yogasanas and pranayam, which can let us deal with this emotional aspect. Again, another aspect is the stress, and it causes many diseases. It may trigger allergies, asthmas, and heart condition. It also disrupts body constitution and create disequilibrium. So knowing how to minimize the impact of stress on our lives and to relieve the symptoms caused by stress is really important in prevention of disease. Proper use of senses, like senses give us pleasure as well as vital information, and improper use can cause imbalance. So 3 things: overuse, misuse, and underuse. We should keep ourselves away from all these three. Then when we are talking about promotive and preventive measures, personal relationships is a very important. Social context, relationships in social context are very important. So our life is a relationship. From birth to death, we encounter different sorts and different kinds of relationships, and these are very much important. So it should be considered that relationships are not battlefields. Basically, it's a love affair. So healthy relationship is a necessity in a person's life, where it can help in disease prevention by getting and receiving love, compassion, and assistance. So we need to understand how to deal with relationships, and it is very important for one's health. Negative emotion arises from a relationship. Instead of judging, criticizing, or feeling anxious, we should look inside and see what our thoughts and feelings saying to us. Be honest. Out of honesty, clarity comes. And when clarity is lacking, feelings are repressed, give rise to mental and emotional sickness that will affect organs of the body. At the next comes the purpose in life. It also can be a reason for many illnesses. For example, most extreme example of illness caused by lack of purpose in cancer. Certainly, we can defeat cancer if we have a purpose. But not having a proper purpose or getting fear, getting stressed after a terminative disease occurs. So, when seriously ill, people discover what they love to do. Instead of what they are told to do, life return to their eyes and some remarkable recoveries are seen. So, we should have a purpose, then only life will be simpler and happier. Then, as we are Indians, we have a great connectivity with the spiritual well-being.
सॉरी फॉर इंटरप्शन डॉक्टर परीक्षित,
Yes, sir.
और टाइम भी थोड़ा हो रहा है नेक्स्ट वेबिनार
Just 2
का,
minutes.
बी
Just 2
फास्ट
minutes.
एंड अग्निहोत्री सर, यदि कोई एडमिट होना चाहता है बिना नाम के तो प्लीज उसको मैसेज भेज दीजिए कि ज्वाइन विथ नेम। डरने लगे हैं हम हैकिंग से। अग्निहोत्री सर।
Okay, sir. So main focus of people should be like having spiritual connection, which will lead to preventive and promotion. And at the end, daily routine is very essential, as we have stated in Dinacharya and Ritucharya. Just we kind of to follow this thing and be healthy and happy. Thank you, sir, for providing me this opportunity.
ये मंच तुम्हारा है भैया, ये मंच तुम्हारा है। मैं कौन हूँ अपॉर्चुनिटी प्रोवाइड करने? दिस मंच बिलोंग्स टू यू।
Yes, I know, sir, but after a long time, I'm trying to present
नहीं,
something.
नाउ इट शुड नॉट बी, नाउ इट मस्ट नॉट बी। ये मंच
Yeah,
तुम्हारा है, संभाल लो।
yes,
अग्निहोत्री सर, ऐसे कोई भी यदि घुसे ना तो उसको मैसेज डाल दीजिए।
नहीं नहीं, अच्छा
अभी
नहीं,
ये
हम
वन प्लस कोई वेटिंग में खड़ा है, मैं डिजाइन बना रहा हूँ, आप जानते
नहीं,
हैं।
मैं इंटरटेन नहीं कर रहा हूँ क्योंकि वो
नहीं,
हमारे पास।
मैसेज डाल दीजिए कि ज्वाइन विथ नेम, हो सकता है
अच्छा,
कोई अपना हो।
हाँ नहीं, ठीक है, ठीक है,
हाँ, मैसेज डाल दिया कीजिए। प्लीज
ठीक।
कंक्लूड।
चलिए, अपने दोनों
बंगाल
आज
की
के
शुरू।
हमारे अतिथि वक्ता हुए, और आज के हमारे जो हमने, जैसा कि प्रोफेसर पवन शर्मा जी ने बताया, हमारे दो कैरी ओवर जो हमारे वो रहेंगे स्पीकर्स, उनको हम 17 को एंटरटेन करेंगे।
तीन मैंने आपको तीन भेजे हैं
तीन
नए।
तीन
तीन
वो
हो गए।
17 तारीख को करेंगे। अच्छा
हाँ,
है।
17 को तीन है। चावुक स्वर भी हैं, मुग्धा गोरे भी हैं, तेजेंद्र भी
हाँ
हैं।
हाँ हाँ
आई
हाँ,
हैव
ठीक
सेंट
ठीक।
यू डिजाइन।
चलिए, वेरी गुड, वेरी गुड। तो जैसा कि प्रोफेसर रेड्डी साहब कह रहे थे, मैं कंक्लूड कर रहा हूँ, क्योंकि उसमें भी आगे रेड्डी साहब हैं हमारे नेक्स्ट। उसमें कुछ स्टूडेंट जुड़े थे, अगर किसी एक आध की कोई क्वेरी हो, वैसे उन्होंने सब सुना है, तो हम एक दो क्वेरी ले
आज
सकते
4
हैं।
वेबिनार है ना सर,
अच्छा,
हम
चलिए
उस दिन
चलिए
ले लेंगे, नो
चलिए।
प्रॉब्लम। उस
हाँ,
दिन हम ले लेंगे। आज
क्योंकि
4, एक के बाद एक 4 है।
इंटरेस्टिंग टॉपिक है, तो आज हम अपने दोनों अतिथि वक्ताओं का बहुत बहुत हृदय से धन्यवाद करते हैं, उनका आभार व्यक्त करते हैं। इट वाज अ वेरी इंफॉर्मेटिव सेशन, एज द पॉजिटिव थिंग्स वर पुट फॉरवर्ड by our guest speakers in the great interest of our